My mother died of esophageal cancer when I was 10 years old. And at that time, I was determined to become a doctor, and specifically to become a medical oncologist, I guess, to treat cancer patients. But after studying medicine, I realized the limits of treating individual patients as a clinician. And then I decided to pursue a career in epidemiology to study how we can better prevent cancer and better detect cancer in an early stage. So that's what got me interested in epidemiology, and I then studied cancer epidemiology for my master's degree and then pursued a PhD in cancer epidemiology at the school here. I studied here from 2011 to 2015. It was fantastic and I learned so much. I think the unique thing of this school, of this particular program, is the interdisciplinary training we got from the program. Like I also pursued a master's degree in biostatistics along the way to my PhD. So that really strengthened my training in quantitative methods, and that helped me a lot in my career, like particularly in my research related to omics, because I'm doing a lot of omics stuff. So that biostatistics training really builds the foundation for my current research. My current research mainly focuses on the role of nutrition in colon cancer, and I've been very interested in studying how we can improve diet to prevent cancer early in the early stage. And to achieve that goal, I have been leveraging the population-based cohort studies with biomarker-based randomized clinical trials to trying to establish causality between nutrition and cancer, and also trying to better understand the mechanisms. Along this line, I have also been interested in studying the interplay between nutrition and the gut microbiome in colon cancer. So as we know, there's increasing evidence suggesting the role of microbiome in cancer, particularly colon cancer, but the evidence is really limited. So what we are trying to do is to conduct prospective studies to establish causality for the relationship between microbiome and colon colorectal neoplasia. So I've been involved in the large-scale microbiome project, which is called the Microbiome Among Nurses, in which we propose to collect the stool and oral microbiome specimens from 25,000 women throughout the United States. So we hope to build platform, a Harvard-based platform for microbiome studies for the next few decades, I guess. I was really fascinated by the resources we have, like the cohorts, the data, like the longitudinal data we have accumulated over the past few decades, so that we can study not just the current exposures on cancer risk, but also the long-term exposures, the remote exposures on cancer, which is very important and very poorly understood. So, and another reason is the biorepository we have at the school. We have collected a variety of biospecimens from the cohort studies, including the nursing health study, health professional follow-up study. We have collected blood, urine, stool samples from these participants, which allows us to conduct integrated epidemiologic studies, not just to understand the relationship between exposure and outcome, but also to understand the mechanism, so that that gives us a better that puts us in a better position to establish causality. I feel the support when I was a student, I was a postdoc, and now as a faculty member. So as a student, I got a lot of mentoring from not just my primary mentor, but also other mentors working in the similar area. So I think that's another unique part of the program. We are very integrated, we are very connected to each other. So as a PhD student, I feel like I'm a part of a big group. like I can get advice from like other faculty members and also other colleagues in the school. And now as a faculty member, I'm also getting like a career mentoring support from my primary mentor and also from other colleagues in my program and in other programs. I think we are a very, very supportive community. Like it feels really great, especially for junior investigator to grow in this supportive environment. I think my favorite memory was still my first email communication with Ed Giovannucci, who was my PhD advisor when I was a student. So when I first approached him, his response was very supportive and also very, very informative. Like he walked me through like different options for application and introduced me to the program, and he was so nice, so friendly. So I feel, which is totally different from the responses I got from other faculty members when during my application. So that really got me like that. I feel like at that moment I was determined that this is a place I want to go. This is a person I want to work with. I want to learn from. So I'm now currently as a faculty member, I really want to inherit this and trying to be supportive and to how to say this, trying to providing as much information as possible to prospective students, and also trying to be supportive to all the students in our program to help with their career development.